I'm going to begin by simply saying thank you very much for allowing me to be here, but also to say that the worst thing you can do whenever they teach you anything about public speaking is to say something like this: "It is truly good to be with you." But I'm going to say that. It is truly good to be with you, and I have come to realize that even saying those words is not a formality. It's a statement about something real. To be with someone is not simply to occupy space. It is to be present in a way that acknowledges the other person and allow them to matter. I was thinking about that most profoundly on Good Friday, where Mary Magdalene was with Jesus at the foot of the cross. And it is Jesus who finds her along the way after the resurrection. That sense that while others were abandoning Jesus, she was there because she knew that he mattered to her as much as she mattered to him. That's what presence means. That's what being with others means. I've learned that presence is not automatic. You can be in a room and still be distant. You can be surrounded by people and still feel alone. That is why the word with carries such weight. It points to something deeper than proximity. It speaks of relationship. It speaks of identity. I see I touched something here. That word with is not just poetic language. It names something we all recognize, even if we do not always say it aloud. A room can be full like this, and someone in that room can feel completely alone. You've seen it. You may have experienced it. There's conversation, there's movement, there's laughter, and yet something's missing. We are living in a time, as Cardinal Tobin said, where, in essence, when connection is constant, but really communion is not, especially among our young youth. And so I have come to say it clearly: isolation kills, but communion heals, and profound communion, especially in our Eucharistic celebrations. I say that because I've seen it, and I've experienced it. In my own family, I have lost 3 siblings. One when I was 13 years old, another along with my brother-in-law when I was 21 years old in college seminary, and then my sister Mary shortly after I became Bishop of Phoenix. And then just a month ago, I just came back from the funeral. Our family was hit by another suicide, my oldest nephew, Brendan. And even now, as I say this, these words don't come easily. There's a silence that follows that kind of loss. It's different. Something very different happens. There are questions that do not always have answers, kind of like you couldn't answer the question. And in truth, I can't either. I can't either. You find yourself wondering what more could have been done. And this is especially true when people die by suicide and you are a survivor of suicide loss. It's one thing when you lose someone who dies, say like my grandmother, when she died naturally. You might say, gosh, I wish I said I love you more. But that's different. Because often there is this disconnect between the amygdala and the hippocampus, the constant, you're missing something. There's something that's amiss. You find yourself wondering what more could have been done, or where did I go wrong? How come I wasn't there? Did I say something inappropriate? And it's this weird way of reacting to someone who has died by suicide. What might have been, how may I have made a difference? One of the hardest truths to face is that a person can be deeply loved and still feel completely alone. That's why presence matters. Not abstract care, but real encounter. I have seen how even simple presence can begin to open a door. Someone shows up. Someone stays. Someone listens. It does not solve everything, but it begins something. The person is no longer alone at that moment. And let me say this clearly and without qualification. Struggle is not a failure of humanity. Silence is. When we clam up, it can be very hurtful. When we treat addiction or mental illness as something that must be concealed or explained away or endured alone, we unintentionally transform human suffering into spiritual isolation. And isolation is where despair grows. This is true, and we were talking about this just earlier. Some priests and we were just chatting about this earlier. This is true even among leaders of faith. The tragedy is not that priests struggle. The tragedy is that many believe they must struggle alone. I've met priests who waited years before seeking help, years of quiet anguish, because they feared disappointing their bishop or their community or their people. I've met women religious who believed their vows required endurance without expression. And I want to say this with a pastoral sensitivity, but also clarity. Endurance is not the same as holiness. Suffering in silence is not a sacrament or a religious virtue. When silence becomes a substitute for trust, even the wider community suffers. At the root of stigma is often this false theology, one we rarely articulate but quietly absorb. It is the belief that prayer or sacred events, such as ordination or marriage, will somehow fix us or somehow exempt a person from human vulnerability. That grace replaces psychology, that faith negates trauma. That kind of holiness looks like emotional invulnerability. But this is not good theology. It's certainly not good anthropology. God does not erase our humanity. God enters into it. If God works by eliminating vulnerability, then God's relationship would have looked very, very different. But Scripture tells us a different story. The God of Abraham and Isaac and Jacob, the God of the Hebrew and Christian Scriptures, saves the world not by avoiding humanity or human suffering, but by entering it fully. In virtue of every religious vision, weakness is not the enemy of grace. Unacknowledged weakness is. Even unacknowledged limits of our human capacity. Breaking stigma does not mean minimizing suffering. It means telling the truth without shame. Whenever I have an opportunity to speak in our high schools, I ask the students, I say, how many of you have phobias? This is how I begin the conversation. How many of you have phobias? And about half of the hands go up. And I share that my phobia is dogs unleashed, because I was taken down by a dog when I was in 8th grade. And so that whole thing, my knees start knocking, as Paul Lynn used to say. That's old too. It means telling the truth, but breaking stigma does not mean minimizing suffering. It means telling the truth without shame. It means saying openly, mental illness is not a moral failure. A phobia is a level of mental illness. It's not hypermental illness, but it is a level of mental illness. it doesn't mean that anyone with a phobia is a failure. Addiction is not a lack of faith. Trauma is not a sign of spiritual weakness. I was spiritually accompanying someone recently who said, I need to take the good with the cross. And I said, can you repeat that? I need to take the good with the cross. She didn't say, I need to take the good with the bad. There's nothing bad about our limitations, while at the same time, our limitations can be a cross. Our many complex human realities involve biology, psychology, relationships, history, and yes, spiritual longing. And when we pretend otherwise, we burden people not only with their suffering, but with the belief that their suffering somehow disqualifies them from love or leadership or belonging. That belonging is profoundly damaging, or because the truth is this: God does not wait for us to be well before drawing near. God draws near because we are wounded, or at the very least, humanly limited. Christ is Emmanuel, God with us, not when we have set things right. He came to us, he comes to us, and remains with us because that is God's nature. In a gratuitous way, God came to us, says Pope Francis. Take, for example, God's mercy. I've been reflecting on this. Mercy is a part of God's nature. His rachamim is this beautiful gift, this thing that just starts when we reach for the tree of the knowledge of good and evil. That beautiful exultate where deacons or people who can honestly sing will lead us through the exultate and say, they go through that wonderful part. It's the felix culpa. Oh, happy fault. Oh, necessary sin of Adam. If Adam had not sinned, God would have had no reason to save us. Think about that. But the mercy was already a part of God's identity before it was enacted. And it was only enacted when we enacted our free will. God gave us free will. And that beautiful image of reaching for the tree of the knowledge of good and evil is like taking a car out for a joyride. The first time you're able to use that free will. And God's free will, his mercy, which is already embedded in the identity of God, is enacted. And all of a sudden, we have salvation history. This is also true regarding God's withness, his being Emmanuel. Studying Bernard Herring's The Christian Existentialist, I discovered a philosopher who expressed this with striking clarity. Gabriel Marcel, a French existentialist in the 1950s. He was less interested in what we do, what we might call agere, the doing, and more interested in what it means to be, or esse. He spoke about the difference between action and being, between what we accomplish and who we are. And he offered this insight: to be is to be with, which is the essence of my talk. This followed his reflection on us being made in the image and likeness of God, and more precisely, made in the image of Emmanuel, God with us. That statement is simple, but it isn't shallow. It suggests our humanity is fulfilled not in isolation, but in relationships. John Milton's "No man is an island" is indeed a truism. We do not become ourselves alone. We become ourselves in the presence of others. When I spoke at the Franciscan School of Theology at the University of San Diego a couple of months ago, this being St. Francis' 800th anniversary of his death, I reflected on how this insight resonates with our own theological tradition. We have the remarkable work of Thomas Aquinas, who gives us a clear and universal understanding of the human person. His work is precise and it's enduring, and it provides a framework that helps us understand what it means to be a human in a general sense, a universal sense. And at the same time, the Franciscan tradition, especially in the life of St. Francis of Assisi, approaches the human person through encounter. So he takes that theological construct of what it means to be a human body, soul, intellect, and will, all of that. And Francis takes that universal matter and brings it to the person. Francis does not begin with a definition or a construct. He begins with a person. He does not first ask what the human person is in the abstract. He asks who this person is in front of me. There's no contradiction here, but there's just a shift. One approach begins in the classroom. The other begins in relationship. One offers clarity about the universal, and the other reveals the dignity of the particular. In Francis, this becomes very concrete. His encounter with the leper is not theoretical, it is immediate. He draws near to someone he once avoided. This is where mental health ministry is important, because we can be afraid of someone who might have schizophrenic personality, or a person who has a manic depressive personality. How do you deal with this? It can be quite exhausting. And so the first temptation is to avoid the person. In that moment, though, Francis discovered Christ. That encounter reshaped his understanding of everything. This movement from the universal to the particular is essential for us today. We still need clarity about what it means to be human, but we must not lose sight of the person in front of us. In fact, we must find the Christ in us. We must remember Francis' own words, proclaim the gospel always, and if necessary, use words. The gospel is not always about action or words. First and foremost, the good news is already embedded in us. We are a living, breathing, walking gospel. Good news. So while not losing the universal constructs of what it means to be human, we step out of the classroom and put our humanity in action by being with. To be made in God's image and likeness means to be with. Interestingly, what theology has long taught is now being confirmed by research. A 2020 study published in the Journal of American Medical Association Psychiatry examined data from more than 100,000 individuals. It's a lot. It's a good study. The researchers focused on deaths of despair, including suicide, drug overdose, and alcohol-related illnesses. For this study, researchers analyzed data from the Nurses' Health Study of 66,000 women, as well as data from the Health Professionals Follow-Up Study on 44,000 men. Among the women, there were 75 deaths from despair, 43 suicides, 20 deaths from poisoning, and 12 deaths from liver disease and cirrhosis. Among the men, there were 306 deaths from despair, 197 suicides, 6 deaths from poisoning, and 103 deaths from cirrhosis of the liver. After adjusting for numerous variables, the study showed that women who attended services at least once per week had a 68% lower risk of death from despair compared to those never attending service. That says something. Men who attended services at least once per week had a 33% lower risk of death from despair. I'm not sure why it wasn't 68, but maybe men were lying and they weren't going to church. But not to bore you with more studies, I will just point out two university studies. One from the University of Washington, that social connection has a profound impact on human health, with research consistently showing that people who are more socially engaged live longer and experience better physical and mental and cognitive outcomes. In contrast, isolation carries serious risks. A report from the U.S. Surgeon General found that chronic loneliness can increase the risk of premature death to a level comparable to smoking up to 15 cigarettes a day, and it raises the risk of dementia in older adults by roughly 50%. These outcomes are not merely social or emotional, but deeply biological. Chronic loneliness elevates stress hormones, such as glucocorticoids, which can damage the hippocampus, the brain's memory center, thereby accelerating cognitive decline. At the same time, strong social bonds support cardiovascular regulation, which in turn protects brain health and reduces the likeness of neurodegenerative disease. That's one study. The Stanford study most recently, Ben Rhine, a neuroscientist, distinguishes loneliness as the feeling of lacking social contact, while isolation is the objective state of being alone. He notes that from 2013 to 2021, Americans spent about 36 more hours alone per month. And in 2022, 58% of Americans reported being lonely. Rain argues that social connection is as essential as sleep and diet and exercise, calling it a person's social diet. The biological effects are significant. Isolation activates the body's stress system, raising cortisol and contributing to chronic inflammation, which may worsen health outcomes. Rain cites research showing that highly isolated people have about a 50% higher risk of death from any cause, and among adults over 65, isolation is linked to a 78% higher risk of death in men and 57% higher risk in women. Social interaction, by contrast, releases oxytocin, serotonin, and dopamine, which improve mood and bonding, motivation, and resilience. Rain also notes that isolated people with dementia may experience memory decline twice as fast as those who are socially connected. His core point is simple: the brain needs friendship and belonging, not as luxuries, but as basic conditions for health. In our seminary training, you may have had experiences, or any of you priests, we knew that we had to have our intellectual life, we had to have a prayer life, we had to have our physical life, but we also had to have our social relational life. And that made up our spiritual life. Prayer isn't our spiritual life. That's one aspect. But the social relational life is equally important. This does not eliminate suffering by any means, that social relational aspect. It is one part. But it does point to something important. There's something about belonging, about being part of a community, about being known, that affects a human person in a very profound way. And this brings us to the heart of our faith. In De Lexite, Pope Leo XIV's first apostolic exhortation, he reflects on two statements of Jesus that take on deeper meaning when held together. It was a real aha moment for me. Jesus says that the poor will always be with us. He also says that he will be with us until the end of time. These two sayings of Christ are the theological backdrop for the church's call to a preferential option for the poor. When we hear these together, lo, I will be with you until the end of time, and the poor you will always have with you, we begin to recognize something. If the poor are always present, and Christ is always present, then Christ is encountered among them. This is not always comfortable. It asks something of us, though. It invites us beyond abstraction and into relationship. Pope Leo reminds us that our tradition has spoken clearly about this. And of course, as Cardinal Tobin mentioned, Augustine is getting mentioned a lot more lately. And of course, he does in De Lexite. He said that St. Augustine of Hippo reminds us that the poor are the very presence of Christ. He also pointed to St. John Chrysostom, who challenged us not to honor Christ in one place, like in adoration. You have adoration, that's fantastic, while neglecting him in another. These insights come into sharper focus in our purpose for our gathering today and in our own pastoral approach toward mental health ministry. In the Diocese of Phoenix, we established our Office for Mental Health Ministry because we recognize that isolation is not a social issue. It is a human and spiritual crisis. I'm very happy that Deacon Schoner is here. He and I and Dr. Wendell Callahan at the University of San Diego helped to establish a curriculum on establishing mental health ministry in various dioceses and parishes. And it's been great, and we've walked together our own particular personal journeys, but also this wonderful, we've been opening doors for mental health ministry. But we built that ministry around 3 pillars. One is education, the other is accompaniment, and the other is advocacy. Allow me just to share a little bit about what we're doing in Phoenix. Education helps people understand how to respond when someone is struggling. It reduces fear and uncertainty. It takes the guessing game out. Using what is called mental health first aid, education forms people to recognize signs of distress and then to respond with compassion. Accompaniment brings that understanding into relationships. So we have an office specifically for education, and we have an office for accompaniment. It's the decision to walk with another person over time. And while there are tools for one-on-one or group-led accompaniment sessions, we insist that accompaniment is not a program. It is a posture. It is where communion becomes real. Pope Francis said he prefers the word spiritual accompanier versus spiritual director, because a spiritual director somehow thinks, I know what you're thinking. I know how to get you from A to Z. A spiritual accompanier listens. It's truly synodal. I'm going to listen to you. In addition to education and accompaniment, we have a special office for advocacy. And this is where some wonderful things are taking off. Advocacy extends that care into the broader community. It seeks to shape our parishes and civic institutions so that they reflect the dignity of every person. It ensures that mental health is not ignored, but integrated into the life of our church and in our society. Just a few examples. We were able to work with the Maricopa County Sheriff Department to allow peer-to-peer accompaniment sessions in our prisons, training some in prison to be group leaders in what we call wells, as in Jesus meets a woman at the well. And through that accompaniment at the well comes wellness. Additionally, we got behind an initiative to increase 350 more beds at Valleywise Community Hospital. And our Office for Mental Health is also connecting now with the University of Mary in Bismarck, which has a satellite campus in Phoenix, to establish a first ever Fotina project. Fotina is the name of the woman at the well in the Orthodox tradition. This will offer a cohort of 15 men and women with grants to receive an MS in psychology while interning as counselors in our Catholic grade schools. These pillars of education, accompaniment, and advocacy, are not separate. They work together. They move us from awareness to presence and to transformation. Interestingly, as we've been building this mental health ministry office over the last 4 years, our diocese, guided by our vicar for synodality, has been listening closely to our young adults. And it's wonderful to watch how these things start to work. Cardinal Tobin and I, we were talking about how the Spirit really is moving. You think about all these Gen Z people coming back, or not coming back, but coming for the first time to church. And it's something to behold. And it's really a Spirit-driven gift. But this vicar for synodality has been listening closely to our young adults. And through our diocesan synod of young adults over this last year, we heard these young men and women express a remarkable unity about what they are seeking. Across diverse backgrounds and life situations, nearly 1,000 young adults expressed 5 interconnected core needs. They laid 5 converging priorities before us: belonging, healing, formation, accompaniment, and safety. That sounds like what we're talking about. It's a need that they want, and it was also a need that they were seeing in the church. They want to belonging. They want to belong. They want to be known and welcomed and integrated into the life of the church. They long for healing. Many carry wounds and look for places where they can be honest without fear. They're asking for formation that is deep and meaningful, something that goes beyond the classroom. Pope Francis has really pushed that in our seminary system. He had pushed that with the propedeutic experience of really trying to go deeper than just the intellect. Something that connects faith to life. They desire accompaniment. They want people who will walk with them over time. And they seek safety, a place where they can be real and still know that they belong, where the church is a refuge of reverence and stability and trust in an anxious and very fragmented world. When I hear these priorities, I hear a consistent message. They're begging for what the church has always proclaimed and what science is uncovering. We are meant to belong, to be with. They desire a witness alongside witness. Witness and witness. We're re-examining the way in which we form youth and young adults beyond the classroom and examining how we might approach couples for marriage beyond NFP and pre-Cana classes, and even in our seminary system, as I mentioned. Our seminary model in Phoenix continues to grow, but we're moving from a traditional institutional model to a house model. Our reoccurring theme is formation begins in a home, not in an institution. And this brings everything together. The church becomes recognizable again, not simply as an institution, but as a place of encounter, a place where isolation begins to loosen its grip, a place where a person can begin to believe that they are not alone, a place where hope can begin to take root again. We believe in Emmanuel, a God who knows, a God who draws near, a God who remains with us. We say, in him we live and move and have our being. But my daily prayer is Christ, I allow Christ to say, John, in you I live and move and have my being. It's good to hear both. He's just said 10 minutes and I'm wrapping up. I only have 3 more paragraphs. But we believe in Emmanuel, a God who knows, a God who draws near, a God who remains with us. And now we're sent to be the same. Made in God's image and likeness and made one in Christ through baptism, there is a certain witness about us. If we are to be Christ for one another, we should claim the name Emmanuel, God with us, to be with one another, not only when it is easy, not only when it is convenient, but especially when it is difficult. Because it is in these moments that something holy happens, and in the end we return to this simple truth. Isolation kills, communion heals. Simply put, our essay, our being, must come before our agere, our doing. Our being must stand before our works. To be is to be with. Thank you.